What you think about tendinitis is probably wrong and out of date. And that misinformation is likely making you treat it incorrectly and may very well be why things aren't getting better for you. People throw around the term tendinitis for any pain involving a tendon, tendons being the thick cords that attach your muscle to bone. And the reason for that is because historically we thought that inflammation was the main reason for why we had pain in our tendons. And inflammation is treated with rest, ice, and anti-inflammatory medication like ibuprofen. So because of that, that is what people typically do when they have a tendon problem. But the issue with that approach and why you often don't get better with it is that we have learned inflammation is not the problem for the vast majority of cases. In fact, the medical world has largely replaced that term, that tendinitis term, with tendinopathy, which is basically just a generic term meaning impairment of the tendon. So if you're trying to go and fix the inflammation with anti-inflammatory medications or ice, you're probably in for a bad time because there isn't much inflammation around for you to try and fix. These days, we instead think that tendinopathies happen because of a mismatch or imbalance between how much load you put on your tendon and what your tendon can currently handle. In all these cases, though, the key thing is that when you apply too much load to the tendon, then the cells of the tendon start to get irritated and can begin to break down or degenerate. And current research, something known of as the Continuum Model, it's always hard for me to say that, shows us that this seems to progress through 3 distinct stages. And you can be in just one phase, or you can bounce back and forth between them, just depending on what's going on with you and what activities you're doing. Stage 1 is reactive tendinopathy, and this is the early stage and what happens when you have a acute, just meaning a recent, big bump up in activity. Because the cells in the tendon sense that they're under too much stress, they essentially panic and start to suck water into the tendon, while at the same time they also produce proteins, so other parts of the tendon, to try and stiffen the tendon up. And the tendon does this to try and reinforce itself so that it will be able to handle that mismatched load. It is a protective, thickening attempt by your body to try and handle that increased load. And the reason it does this is because when you have such a quick spike up, there's not enough time for the tendons to actually build more tendon tissue and thicken up or strengthen. And very, very importantly, this stage is also reversible. So if you back off the aggravation, even just a little bit often, the tendon can calm itself down and it can get back to normal. Stage 2, though, is tendon dysrepair. So let's say that instead of backing off, you just keep hammering your tendon with high loads and high levels of activity. Then you'll find that you end up progressing onto this stage. And importantly, too, this progression can happen even without you realizing it, because not everyone will get pain or problems as early as stage 1. Here in stage 2, what happens is that your tendon tries to heal from that early damage, but it fails. And as the body tries to heal, it will create more blood vessels that extend into your tendon, and it will also extend small nerves into the tendon where they shouldn't normally be. And this is something we call neovascularization. And this sounds like a good thing when you hear it at first, right? Because hey, more blood flow, more nerves, just sounds like a good thing, right? But it isn't really, unfortunately. Because of the fact that you have more blood supply and you have more nerves supplying the tendon, it actually makes your tendon more sensitive to pain. And again, although the tendon is trying to heal, it doesn't heal quite right. So if you go look at it with an ultrasound, unlike before where you just saw the swollen tendon, now what you'll see is that the collagen fibers, so the fibers that make up your tendon, which should normally be aligned like a nice straight strand of spaghetti, will instead now be really disorganized and messy, kind of like a bowl of spaghetti after it's already cooked and it's just all over the place. Then stage 3, which is the final stage, is called degenerative tendinopathy. This stage is common in older athletes or in people who have ignored their pain for months or years, or people who only ever rested the tendon but never really properly rehabbed it. Like they got injured, they laid off, they got injured, they laid off, and they did that for years and years on end. Or for people who just kept beating up their tendon for years on end and pushing through the pain. Once you're in stage 3, some of the cells of your tendon have actually died, which ends up making that part of the tendon weaker. But even so, it's not all doom and gloom. People at this stage actually have more total tendon tissue than someone who has a normal or a healthy tendon. And this sounds really counterintuitive, but it happens because your body tries to compensate for that dead part by instead going and creating more new tendon tissue in an effort to try and have it pick up the slack for what is no longer being done by the dead, degenerated part. And this is why you can have a degenerative tendon, but you can still function at really a pretty high level. And it's also a really big reason why physical therapy and why proper exercise programming is beneficial. Because while the new tendon is weak when it is first built up, it can get stronger if you make it get stronger. So with exercise, you can strengthen this new tendon up to the point where it can handle the load that we want it to and that we're asking it to in our day-to-day currently painful activities. And if we build it up enough, we can get it to where we can do those painful activities with less or no pain. As a patient, you don't need to know all the details we just talked about, but you should understand the overall idea of the 3 stages, because those 3 stages and that understanding guides how we treat your tendinopathy. And understanding those stages will help you figure out when you should push yourself to do more, as well as when you should scale back and give yourself a little bit of a break. The big takeaway I want you to get from this video is that the treatment for tendon problems is not total rest or ibuprofen, because relying on those things are likely to make you worse in the long term, even if they feel better here in the moment. And so instead, recovery relies upon modifying and changing your current activities according to what your tendon can currently handle, and then you slowly progress the intensity and how much you're doing over time. And doing that lets you go and build up the strength and the capacity of that new tendon your body has built if you are in the later stages. And that is only done through exercise and physical therapy.